have an interest in this topic, please tune in. This is the Budget Review Subcommittee on Justice and Judiciary for the 2023 interim. Today we're going to receive an update on the Medicaid waiver for substance use disorder treatment for those incarcerated. Any meeting materials received by the deadline were posted online earlier this week and made available for downloading. At this time, we'll have the Secretary call the roll.
Senator Nemes, Senator Schickel, Senator Webb, Representative Brown, Representative Decker, Representative Kulkarni, Representative Sharp,
Present.
Senator Mays-Bledsoe, Senator McDaniel, Representative Petrie, Representative Reed, Representative Elliott, Representative Flannery, Chair Funky Frommeyer.
Present. Thank you. So if we could, we'll go ahead and take our presenters, invite you to take the stand, please. And this is the Department of Corrections and Department of Medicaid Services. And thanks for being here this morning. If you'll please introduce yourselves and be sure to press the button as I forgot to do when I started.
Good morning. My name is Leslie Hoffman. I'm the Deputy Commissioner for the Department for Medicaid Services, and I oversee the behavioral health initiatives within Medicaid.
Good morning. I'm Angela Sparrow. I'm the Behavioral Health Supervisor with the Department for Medicaid Services. I, again, primarily work on our SUD 1115 and our overall 1115 initiatives within the department.
Good morning. My name is Sarah Johnson. I'm the Director of Addiction Services for the Department of Corrections. I oversee substance use disorder treatment for those that are incarcerated and under community supervision.
Thank you. And I'm going to acknowledge that I'm new at this job as a state senator. And one thing that I've learned is if you can use the words for the acronyms. Some of us are somewhat new, but maybe that happens in the community too for people watching. So that'll be real helpful this morning. Thank you. You can go ahead.
Okay, so I'll go ahead and get started. Our main goal today is to answer your questions regarding the current status of our SUD, Substance Use Disorder 1115 Incarceration Amendment, the goals, and the next steps. As you may be aware, 3 years ago, the Department of Medicaid Services, the Department of Corrections, Department of Behavioral Health, and the Office of Drug Control Policy all came together, united as one team, to complete and submit an SUD, Substance Use Disorder 1115 Amendment for incarceration to the Center for Medicare and Medicaid Services, which is CMS. Our aggressive amendment was the first in the nation, seeking SUD services, Medicaid-covered services for those members who are incarcerated. CMS remained very positive with our collaboration with them, but held our amendment for almost 3 years, three years this November, so today. They held the amendment for 3 years in order for them to get their house in order. And what I mean by their house in order is that they had to figure out what they wanted from states. They had never approved one of these before, so they didn't know exactly what they wanted to require from states that would be participating in this kind of initiative. Also, they needed to figure out things like implementation plans, monitoring protocols, evaluations, and standard terms and conditions. To be part of an 1115 demonstration is pretty intense because you're constantly showing them through this demonstration that you're doing what you said that you would do, that you're working through what we call budget neutrality, and that you're making a difference in folks' lives. Finally, the state Medicaid director letter, we call that the SMDL. You might see that listed. 23003, that came out. So that means not until March of 2023 did we receive any guidance as to related of how to actually apply for, or what the parameters would be for a state to actually apply for what they called the re-entry opportunity. So now going forward, the incarceration amendment that we speak about a lot, the SUD 1115, is now known as Kentucky's Reentry 1115 demonstration, and that name is changed based on CMS's guidance and their naming of that opportunity. Our waiver goals are to improve care transition for individuals who are soon to be leaving the public institution by increasing coverage and continuity of coverage post-release. We want to improve care coordination and communication between the carceral settings as well as the community services so that we can bring those two together. We want to address any health-related social needs or social determinants of health, SDOH. If you've heard that mentioned, it means the same thing. Our current status right now is in development. We are right now designing and proposing a waiver design to include the alignment with the parameters that I told you about in the State Medicaid Director Letter of 23003. We are conducting stakeholder interviews to gain knowledge and understanding of current processes, policies, gaps, barriers, and best practices. So we're all working together to understand those things. We are requesting coverage of 60 days pre-release from incarceration. We are addressing adults 18 years and older in state prisons. Members with SUD would also receive case management. And when I say case management, that could be intensive case management. It could be targeted case management. It's also MAT. We'll be covering MAT, which would be the medications plus the therapies. And also sending a 30-day supply of all medications at the time of release, and that's all medications, physical and behavioral health needed. Our next steps are we are currently right now applying a change management approach. We're preparing for change, managing change, and ensuring that we can sustain. That's one thing that we must do to show CMS that we can maintain and sustain even after the waiver demonstration might be over. The next steps would include conducting public comment period in November. The public comment period is soon upon us. It's very soon. We are submitting a revised reentry 1115 demonstration waiver amendment to CMS in December. And we are establishing something new. It's called ACRES, for lack of better acronym. We're calling it ACRES. And it is a committee. It will be an advisory and community collaboration for reentry services committee. And this committee will be utilized to guide program development and implementation planning along the way, so that other folks will have voice at the table. Upon approval from CMS, DMS would then start those things I told you about. We'll start working on the implementation plan, the monitoring protocol, and the evaluation plan as required. So once CMS approves the waiver, it still doesn't get to start. We have within, I believe it's 90 days, some states ask for a little more time to develop an implementation plan for their approval to tell them how that we will roll the waiver out. That's pretty much what was asked. Do you have questions of us?
Yes, thank you so much for providing that. And CMS, I'm assuming, means?
Center for Medicare and Medicaid Services. That's
Okay.
our federal authority.
Okay. And then, yes, Senator Chickle.
Thank you, Madam Chair. Thank you for that concise presentation. It was great. I love concise presentations, and thank you for your service. And I don't want my comments at all to reflect on the job you're doing, because I know you're doing a good job and you got a tough job, and it's great to see you here this morning. But I just want to state on behalf of my constituents that I'm not a fan of this program. Treating drug addiction with drugs at taxpayer expense, to me, is a dead-end street, and I think we're going to find all kinds of unintended consequences down the road from it. I've opposed this from day one. I know it's been very fashionable to treat drug addiction with drugs, but we've seen on the street where with Suboxone and some of these other drugs where we just end up with having people addicted to other drugs. So I just wanted to state that on behalf of my constituents. But I do have one question. So it sounds like you're having to jump through a lot of hoops because I guess is that the federal government?
Yes, sir.
Yeah. So are we actually doing this, or are we still trying to get it implemented as of today?
So we're moving forward now, finally moving forward. Our original plan for SUD is going to be retracted, and we will be submitting for public comment November next week. Our new revised reentry amendment, and we did not get guidance until 2023 from CMS of how to actually write this waiver. So we were pretty aggressive 3 years ago trying to get this started.
So the answer is that it's not implemented yet.
Oh, no, sir. We'll go through public comment. After public comment, we answer our questions.
Are the
that we
inmates
receive.
getting the drugs at this time?
There are certain medications that are available to the incarcerated population at certain locations for substance use disorder.
So are we under full implementation or partial implementation?
Partial implementation.
Okay. Are the inmates leaving the institutions getting the drugs or prescriptions for the drugs?
Are you specifically asking about medication for addiction treatment?
Yes. Mm-hmm.
They are not leaving with that in hand. They are connected with a community provider to continue that care.
Great. Okay. Your answer leads me to another question I hadn't thought of. What about other medications?
Other medications, they are leaving with those medications for physical health.
Okay. And is that something new, or have we been doing that all along?
I can't tell you today when that started, but we can get you that information.
Okay. Thank you. And thank you for a great presentation. Very, very clear and concise.
And thank you. I did want to draw a few more questions. With this being one of the first of its kind, the innovation, I appreciate coming from Kentucky. What are we seeing from other states? Are there any other states that actually do have this moving forward, maybe ahead of us initiating it, but maybe other states are further along? What are you seeing there?
I can start the conversation. If Angela has anything to add, she can. So California actually got approval. They had been working on a 5-year pilot project with CMS. They had a $419 million grant for capacity to get that started prior to getting waiver approval. So California and I believe Washington are the only two right now that are moving forward. So it's hard to compare Kentucky to California. I get asked a lot about, why did California get approved first? Why does theirs maybe look a little bit different? It's the need that California had and the funding that they had to get started. So they actually got started before the guidance came out. Do you want to say anything specific?
I, again, agree with what Leslie said. There are, I think, approximately 13 or 14 other states with pending incarceration or reentry amendments under 1115 demonstration opportunities. California and Washington, as she stated, is the only states at this time that have been approved. However, they, again, are not fully implementing, still waiting on their implementation plan, reinvestment plan approvals from CMS. So, again, that's the second piece of the approval process.
Thank you for that. And as we know, this is the budget review subcommittee. So from a budget standpoint, what dollar figure are we considering that this Medicaid waiver process will save us in the Commonwealth by drawing these dollars from the federal government instead of drawing from our taxpayers' pocket currently in Kentucky?
So currently, right now, we're working on the budget neutrality piece to submit to CMS. I said if this meeting had been just a little bit farther down the road, we would have been completed. We have public comment going out like next week, so we think we should have that completed in maybe a week or so. So we all have to operate with the 1115 demonstration based on what we call budget neutrality. So if we tell CMS we want to do something outside the box, something with flexibility, something that kind of goes outside the normal rules of what Medicaid's allowed to do, that we have to look over budget neutrality. And that means that the services that we are asking to provide would be equal to or less than the current service costs that we have with a better quality of life for the members. So I don't have numbers for you today, but we do everything based on budget neutrality. Now, once the waiver would be approved, it'll be a little bit of time because we've got all those steps that we told you about. We should be able to draw down what we call a 30-70 match. So we put in 30 and the federal government would cover 70.
And I apologize for pressing a little bit on that, but the 30-70, any ballpark numbers, 30% of what number?
I better not come up with anything today because I don't feel like I would give you an accurate number. When we did this 3 years ago, we were basing it on different services. So, again, we might have that within a week or so.
I'll be excited to know that number. We're eager to put some dollars to work very wisely in Kentucky so that
Wonderful.
the budget impacts will benefit us in other areas. I'm hopeful. Wonderful. Do we have any other questions, Senator Schickel?
And Madam Chair, please excuse me because I know this is the budget subcommittee and my comments aren't exactly about budget, but I've also learned never to waste a forum. It's interesting to me, but first of all, can I have some leeway?
Yes, please.
Thank you. It's interesting to me that we look to California and Oregon as states that are out ahead of us, and generally in the treatment world, we hear these states being held up as an example of their for so-called treatment of so-called a substance abuse disorder. Been in Portland and San Francisco in the last 2 years, and you literally have to step over the drug addicts laying on the streets. And they, according to the clinicians, have some of the best drug treatment, not maybe in the definitely in the United States and maybe in the world. So to me, that's just interesting and a comment I wanted to make.
Yeah, this is very, very difficult subject for sure. Was there any other high notes that you wanted to touch on before we wrap it up?
No, other than we're all excited, and I cannot tell you how wonderful it has been that we've really dropped down barriers and worked together in integration to make these services happen for the Kentucky members. So that's been wonderful, even outside of our cabinet.
Thank you. It is such hard work and important work. We know independent, productive members of our society are actualized with good work and being out there doing something good in the community. And if we can change the trajectory, it will impact a lot of lives. Good. Thank you. Thanks for being here today.
Thank you, Madam Chair.
All right. If we don't have any other issues for the committee, then we are adjourned. Can I get a motion for adjournment?
Second.